Mears, CEO of Alleviant Health Centers.
Hello, I'm Dr. Lawless, a psychiatrist and Chief Clinical Officer at Alleviant Health Centers.
As we all know, our nation is in crisis. The world is in crisis. And we're facing unprecedented challenges across the world. Our healthcare system is now in flux, unlike it's ever been in the entire history of our country. We're facing significant challenges, and it's our responsibility as mental health leaders to keep you up to date with the latest information in mental health and how this virus affects you. The virus is known as COVID-19, or the coronavirus. And the president and governors across the country have been very proactive at addressing this virus and how we can stop the spread of this illness through transitioning patients from inpatient appointments to telehealth appointments. This is going across every spectrum of healthcare. We are behavioral health specialists. As such, your appointments can still be seen via tele-behavioral health services rather than in person at a clinic.
Right, that's right. So we're implementing these changes to stop the spread of COVID-19 and flatten the curve, as I'm sure most of you have heard in the news. To decrease the rate of transmission, there are multiple things that we're doing. So we're extending our telehealth hours from 8 a.m. to 8 p.m. Monday through Friday. We're going to continue to offer on-site services like most clinical practices in the community, taking necessary precautions to ensure that both our patients and our workers are safe in a clinical setting. And further, we are going to just continue to offer the telehealth services and quality mental health that we are already providing here at Alleviant Health Centers that allows you to access both medication management and therapy from the safety of your own home.
Now, we want everybody to be safe. We know that on TV shows all across the country, on news stations everywhere, they're saying stay home. Social distance yourself from others. We shouldn't pack waiting rooms where we're sitting arm to arm and getting sneezed and cough on when we're here for a mental health appointment. We want to help stop the spread of this disease. So with that in mind, we are definitely advocating the transfer of on-site appointments to telebehavioral health services. Go to our website for this information. Go to our Facebook page and you can learn how to do this. It's very simple. But we want to share some information with you. On March 13th, Governor Asa Hutchinson in Arkansas, he put out an emergency proclamation which deregulated much of telehealth oversight that was in place and has been in place for some time. Some of that oversight were rules that said you needed to establish a patient visit in person in a clinic with your physician prior to transitioning to telehealth. He has now waived that. The president has also started waiving these at a federal level for the Centers for Medicare and Medicaid Services as well. There's a lot of evolving information hour to hour with this. We will keep you up to date every day. We would like to keep you up to date also on insurances. Now, as you know, there's hundreds of insurances out there. We will not be able to fully make you aware of everything. But should you desire an appointment with us, we will check your eligibility and verify your benefits and let you know exactly what your insurance company says. But let us give you an example of how the insurance company is trying to help their patients. Aetna has came out with a new rule that says co-pays and deductibles are now waived for the next 90 days for any patient that transitions to telehealth. That's huge if you're an Aetna participant. You don't have to pay your co-pays or deductibles. Also, referrals are waived. In telehealth, you frequently had to have a referral before we could establish care with you and start taking care of you. Now that is waived, and now your physician can establish care at that first contact. Medicare has now started paying for virtual check-ins as well. That means even phone calls. So let's say you don't have a smartphone, an iPad, or a computer. Medicare is allowing you to make a phone call to your provider and talk to your physician over the phone, do a check-in with them, get your medication refill so you don't overwhelm the emergency room when you run out of medicines. That's what everybody's trying to prevent here. We know that medicines frequently have a finite life on that prescription. 30 days, 60 days, and if you're in that window, you're going to find yourself back in a physician's office waiting for a prescription. That physician's office might be closed, or they may have transitioned to telehealth also. So all these insurance companies are working to try to decrease the transmission of this virus. We're also actively working with insurance companies. We have been calling the chief medical officers and the CEO of large insurance companies to work with them through their policy changes to help them understand telebehavioral health, as we've been those providers for some time now.
That's right. And so at Alleviant Health Centers, what's most important to us is your health, safety, and well-being. Please don't hesitate to reach out to us. Contact us at our phone number at 866-951-4325 or visit our website at alleviant.com to find out more information in relation to the COVID-19 virus and the telehealth services that we're offering to work around these issues and these challenges that we're facing within our healthcare industry today.
Thank you very much.
Thank you.